Hello and welcome to another Rush Generations Health Education Lecture. We at Rush Generations are delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, August 21, 2024, and I'm Grisel Rodriguez Morales, Rush Generations Program Director. I'll be your moderator for today's lecture about immunization in the older adult population. The World Health Organization estimates that vaccines prevent more than 2.5 million deaths from communicable diseases worldwide each year. So we're delighted to have this conversation today. I'd like to first thank our producer, Hannah Weitzman, as well as Franco Sambataro, who today is going to help us manage the chat and other key aspects so that we all can have a great discussion. These lectures are live streamed via our YouTube channel, where we have dozens of other health education lectures that you can always refer to. Please feel free to let your friends, family, colleagues know about our channel and any of the other lectures we offer so that they can also benefit from the valuable information that our speakers offer every other week through Rush Generations. We also have a good number of people who normally join us via phone. At the end of the lecture, you'll also have an opportunity to unmute your audio and ask questions. But for those of you on YouTube, please use the chat function, not only to ask questions, but also to add to the discussion throughout the lecture. And we will make sure that your comments and questions make it to the presenter. Would like to remind you that all the information offered here is for general informational purposes only, and that to always seek information or seek additional professional advice for situations that are specific to you and your needs. We greatly appreciate you joining us today. I'd like to introduce our speaker, Sam Long, who is a community health nurse on our vaccination and testing team, who joined Rush University Medical Center in 2020 during the peak of the COVID-19 pandemic. She has been a nurse for more than 16 years and has worked with a variety of specialties and populations, including orthopedic, medical, surgical, emergency, pediatric, and as a disability nurse care manager. She's also completing her doctoral degree at Rush University in the Advanced Public Health Nursing Program and is passionate about preventive care and vaccinations to protect ourselves, our families, and our community. And she's very excited to join us today. And we are excited that you're here, Sam, as well.
Thank you very much. Thank you. Okay, let me share my screen here and we'll get started. Okay, how does that look? We good to go?
Great.
Excellent. So thank you so much. Hello, everyone. Good afternoon. My name is Sam. I am a community health nurse at Rush. I'm so glad to be here with you all today, and thank you for being here too. So today we're going to discuss the importance of vaccinations for older adults, with a special focus on vaccinations that prevent respiratory illnesses. So as we age, our immune system becomes more vulnerable, making it crucial to protect ourselves from serious diseases. With respiratory virus season just around the corner, now is the perfect time to talk about how vaccines can help us stay healthy and safe. Again, this is just a quick medical disclaimer, so always consult your own provider or qualified healthcare professional for any specific healthcare concerns or questions. Okay, so here's the agenda for today. Here's a quick look at what we'll be covering. We'll start with an overview of vaccines and how they work, especially focusing on why they're important for older adults. And then we'll also talk about vaccine effectiveness, vaccine safety, and common side effects. Then we'll dive into specific vaccines that help prevent serious illness. We'll also talk about where you can get vaccinated, spotting vaccine misinformation, and then wrap up with some key takeaways with a Q&A session at the end. So if everyone is ready, let's get started. Okay, so vaccines have saved more lives than any other medical intervention. This is including antibiotics or surgery. It is the most effective health intervention ever created, and it has greatly improved our quality of life by reducing or eliminating many serious diseases. Vaccines work by training our immune system to recognize and fight off viruses and bacteria, preventing diseases before they even start. We now have vaccines to prevent more than 20 different life-threatening diseases, helping people of all ages live longer, healthier lives. Immunizations or vaccines prevent 3.5 to 5 million deaths every year across the globe from diseases like diphtheria, tetanus, pertussis, which is whooping cough, and influenza and measles. The first vaccine was developed over 200 years ago for smallpox. So way back in 1796, Dr. Jenner created the world's first vaccine. So he actually took a skin sample from a cowpox sore from the hand of a milkmaid to vaccinate an 8-year-old boy who then developed protection from smallpox. It was successful. And fun fact, the word vaccine comes from the Latin word for cow or vaca. Over the last century, vaccines have revolutionized public health, leading to the near elimination of diseases like polio, measles, and smallpox. Advancements in vaccine technology have made them safer, more effective, and widely available, helping protect millions of people from life-threatening diseases. So let's look at diseases back in the 1900s compared to 2019. So on the left side of the screen is the early 1900s, and on the right with the smaller bubbles is 2019. So in the early 1900s, diseases like polio, measles, and diphtheria caused thousands of cases and deaths every year in the United States. But thanks to widespread vaccination, these numbers have dropped dramatically, with some being nearly eliminated. Vaccines have played a crucial role in reducing the burden of infectious diseases, saving countless lives. And just to give an example, on the left side here, that big purple circle, it represents the measles disease cases in the 1900s compared to 2019, that tiny little purple one. And it also gives the numbers back then too. So measles cases, 530,000 compared to 2019, which was just 1,275. So huge differences because of vaccines. What do vaccines do? So vaccines protect you by teaching your immune system how to fight off bacteria or diseases, preventing you from getting sick in the first place, especially from contagious diseases. Vaccines protect everyone around you, including those who may not be able to receive some vaccines, like really young infants, pregnant women, and people with very weak immune systems. If you become infected with the disease, it can also protect you from getting really sick, becoming hospitalized, or dying. How do vaccines work? So, vaccines help to teach your immune system how to recognize and fight off disease-causing germs. So vaccines typically contain a weakened or killed or manufactured version of the germ or parts of the germ called antigens. Antigens are just a substance that make an immune response in our body, and they could be anything like proteins, carbohydrates, lipids that are a part of the germ. That's actually how the flu vaccines work, is it's a killed version of the flu virus. But some newer vaccines, like the COVID-19 vaccine, they provide instructions to your body to make the antigens. So when you get a vaccine, your body's immune system responds to the antigen. If it were exposed to the actual germ, it makes the fighter antibodies and it remembers how to get rid of it. Then, if or when your body gets exposed to that germ, the immune system can recognize it right away and quickly fight it off to prevent disease or significantly minimize serious illness. Why is prevention important? So prevention is important because it helps stop diseases before they start, reducing the risk of serious illnesses and complications. By preventing diseases, we not only protect our own health, but we also help prevent the spread of infection to others, including those who may be more vulnerable, again, like older adults and young children. Preventing illness through vaccination is often more effective and less costly than treating diseases after they occur. So if we look on the slide here, for COVID-19, compared to people ages 18 to 39 years old, people who are 75 years old and older are about 9 times as likely to die from COVID-19. And then when talking about RSV, each year in the United States, it's estimated that 60,000 to 160,000 older adults are hospitalized due to RSV, and 6,000 to 10,000 die due to RSV. Significant numbers. 70 to 85% of all the seasonal flu-related deaths and 50 to 70% of all seasonal flu-related hospitalizations occur in people who are 65 years old and older. Also, this is a severe statistic, but over 95% of adults who were hospitalized in 2003 to 2004, 2023 to 2024 due to COVID had no record of receiving the latest vaccine. So if you were in the hospital for COVID, more than likely you did not receive the updated COVID vaccine. So older adults need vaccines too. So vaccines are crucial at every stage in life, but they become especially important as we get older. As we age, our immune system weakens, making us more vulnerable to infections and the serious complications that can follow. This is why vaccines are so important for older adults, particularly those over the age of 65. It's easy to think of medical care as something that treats an illness after it happens, but vaccines work differently. They prevent diseases before they even start. So by getting vaccinated, you're not just protecting yourself, but those around you, including your family and your friends and others in the community, especially those who can't be vaccinated due to their young age, immune system status, or certain medical conditions. When vaccines do their job, we don't notice much. There's no outbreaks, there's no disruptions, but we should really value that sense of normalcy and the protection that vaccines provide our community. So it's important to stay up to date with your vaccinations and continue to protect those, protect yourself and those around you. Oh, freeze there. There we go. So many adults don't realize that they still need vaccines or may not know which ones are recommended for them. Some might think vaccines are only for kids, the elderly, or people with really poor health, but that's not the case. It's important to advocate for yourself. Ask your doctor about the vaccines you need and make sure you're up to date, protected, and safe. Unfortunately, many adults aren't getting vaccinated simply because they're unaware that they should. Each year, vaccine preventable diseases claim the lives of tens of thousands of people. While most people know about the flu shot, they may not realize that there's other important vaccines for adults, like those for pneumonia, whooping cough, and shingles. This is starting to change as more adult vaccines are being offered and promoted, but we still need to make adult vaccinations a priority in our communities. By doing so, we can protect ourselves and others from preventable diseases. So this is just a little graph to show that as we age, our immune system naturally declines in function. It usually peaks around the age of 20 and then gradually weakens over time. This decline makes older adults more vulnerable to infections, diseases, and even conditions like cancer and chronic illnesses. So because of this, getting vaccinated becomes even more important to help protect against preventable diseases and maintain health as we get older. So using COVID-19 as a recent example, comparing the age group 5 to 17-year-olds to those who are 50 years old and older, as we age, your risk of infection, hospitalization, and death significantly increases. So again, they use the 5 to 17-year-olds as the reference group here. And if I look at 75 to 84 years old, that category, that column right in the middle, they're more likely to, they're 65 times more likely to be hospitalized and 3,200 times more likely to die from a COVID infection. And if we move to 85 years old and older, you're 2 times as likely to get infected, 95 times more likely to be hospitalized, and 8,700 times more likely to die from a COVID infection. Significant differences as we age. So vaccines are effective. This is a chart showing the reported polio cases and deaths in the United States from 1910 to 2019. So if you see my top arrow there is the year 1952. There was over 57,000 cases and over 3,000 deaths. And then my middle arrow there is April 1955. That was when the polio vaccine is licensed for use in the United States. And then if you look at my very bottom arrow there, 1962, which is 10 years after that peak was, in 1962, look how significantly that decreased. So 910 cases and 60 deaths compared to what it was 10 years earlier in 1952. This is a chart showing nursing home deaths before and after the COVID-19 vaccine. So this is showing from July 2020 to, I believe, January 21. If we look at that red line is the deaths among nursing home residents, you'll see it dip a little bit in July, come back up, dip again in September, and then shoot back up. Right around the holiday time. And then that line, that gray line down the center, is when the vaccinations came out, when the rollout began, where nursing home residents could get vaccinated. And then look at that sharp decline after that, sharp decline of deaths among nursing home residents because they were able to get vaccinated. Makes a huge difference. Also talking about COVID-19, this is actually local information from the Chicago Department of Public Health. This is the weekly rate of COVID-19 deaths by vaccination status. So they organized it of, did you get a booster? Were you fully vaccinated or unvaccinated in this chart? So my 3 arrows are highlighting the unvaccinated individuals. And the very, very top is those who are 80 years old and older. And then the one 65 to 79 years old and 50 to 64 years old. So compared to everyone else on this chart, these are really high numbers. And again, these were the individuals who were not vaccinated from COVID-19. For the flu, to talk about the flu, so this is the estimated number of flu-related illnesses, medical visits, hospitalizations, and death that are prevented by the flu vaccine. So for those who are 50 years old and older, the CDC, which is the Center for Disease Control and Prevention, estimates that flu vaccines prevented, and we'll go one by one, over 1.6 million illnesses, over 755,000 medical visits, over 44,000 hospitalizations, and more than 4,500 deaths. So all of those could have been prevented by the flu vaccine. Oh, and I forgot to mention too, my little green highlight there is highlighting the age group 50 to 64 years old and then 65 plus. So those are the numbers I was using for those numbers on the left. So vaccines are safe. So in the United States, there are many safeguards that are required by law to help ensure that the vaccines we get are safe. because vaccines are given to millions of people every year to prevent serious illnesses and diseases, they're held to very high safety standards. So vaccines are safe and they undergo rigorous testing to ensure they are effective and have minimal side effects. So before any vaccine is approved, it goes through extensive clinical trials to verify its safety. During a clinical trial, a vaccine is tested on people who volunteer to get vaccinated. They help to answer important questions like, is the vaccine safe? What amount works best? And how does the immune system react to it? Also, every batch of vaccines are tested for quality and safety. And then once in use, once it's been distributed, vaccines continue to be monitored for safety and any potential risks are carefully studied. The benefits of vaccination, such as preventing serious diseases, far outweigh any possible risks. Vaccine development often takes 10 to 15 years of laboratory research. Before a vaccine can be tested in people, researchers study its ability to cause an immune response in small animals like mice. At this stage, the researchers might make adjustments to the vaccines to make it more effective. Vaccine effectiveness is important because it measures how well a vaccination protects people against outcomes such as infection, symptomatic illness, hospitalization, and death. Next, the vaccine enters a clinical development stage, which is also called the clinical trial. Those are those like green lines in the middle. That's the clinical trial portion. The first phase, it's a very small group of volunteers that get the vaccine, maybe 20 to 100 people. And then the second phase, it expands to hundreds of volunteers. And then the third phase expands into thousands of volunteers. And then after the FDA approves a vaccine for use in the general population, phase 4 is a formal ongoing study to evaluate the new vaccine safety and effectiveness over a longer period of time. Also, I wanted to tell you guys about this program called vSafe. I'm not sure if you've ever heard of it before, but vSafe is a tool from the Centers for Disease Control and Prevention that lets you easily share how you feel after getting vaccinated through a quick confidential check-in that you can do actually via text or email. So by participating, you help others know what to expect after a vaccination and assist the CDC in monitoring vaccine safety. You can also enroll your dependents if you want to. It's simple to sign up at vsafe.cdc.gov and you can opt out anytime. So very important program to keep monitoring the vaccine safety. And you can do this for COVID and RSV, by the way. So side effects from vaccines. So everyone's different. Many people may experience side effects after receiving a vaccination. Keep in mind that common side effects means that your body is building immunity or protection against a disease. So it's doing exactly what it's supposed to do. Minor side effects like the ones listed, sore arm wherever you receive the vaccine, low-grade fever, muscle aches, headache, and feeling tired. Those are the most common. Side effects usually resolve on their own completely and usually go away within a few days. Bottom line, vaccines are very safe and closely monitored to keep them that way. While you might have some minor side effects at first, the protection they offer in the long run is much more important, and it helps to keep you healthy. So just something to keep in mind. Okay, so let's talk about some of these individual vaccines. We'll start off with influenza, which is the flu. I'm sure you all are familiar with the flu, unfortunately. So what it is a respiratory infection caused by the influenza virus. Symptoms, again, you're probably familiar: fever, chills, cough, sore throat, body aches, headache, fatigue, any of those. How it spreads, mainly by droplets made when a person with the flu coughs or sneezes or talks. The droplets can land in the mouths of noses of other people or who are nearby and possibly breathe them in and into the lungs. So vaccination directions. If you're 19 to 64 years old, you can get 1 dose of any flu vaccine once a year, usually in the fall. And again, September and October is the best time to receive the flu vaccine. If you are 65 years old and older, you can receive a higher dose flu vaccine or an adjuvanted flu vaccine. So talk with your doctor about what's best for you. For people who are age 65 and older, their flu vaccines designed specifically for older adults. Those are the higher dose flu or adjuvanted flu vaccine. Helps create a stronger immune response in people who are of that age group. Next up, we have COVID. It is a respiratory infection caused by the SARS-CoV-2 virus. Symptoms it can cause really everything that I mentioned for the flu, plus a loss of taste or smell. So how it spreads: when an infected person breathes out droplets, very small particles that contain the virus, and then other people can breathe in these droplets and particles, or they can land in their eyes, nose, or mouth. In some circumstances, these droplets may contaminate surfaces that they touch too. Vaccination directions for this season coming up for 2024 to 2025. Everyone age 6 months old and older needs an updated dose. And that could be of Moderna, Pfizer, or Novavax. And again, the fall is the best time to receive the COVID vaccine. So keep an eye out for that and be ready because it's coming soon. Unfortunately, last year, very few people got last year's updated COVID vaccine. Only 22.5% of adults and 14% of children across the country. So unfortunately, also, most COVID hospitalizations are in adults 65 and older, with the highest rates in those 75 years old and older, as well as infants under 6 months who are too young to be vaccinated. This is actually very up-to-date information that my nurse manager shared with me yesterday. COVID killed 1,000 Americans just this last week. So we cannot let our guard down. COVID vaccines are still very important, and it's recommended that everyone 6 months old and older receive the updated vaccine this fall and then continue to stay up to date every year. Okay, I'm sure some of you have maybe heard about RSV, and I wrote out how to pronounce it because it looks a little tricky. So it's respiratory syncytial virus. So what is it? It's a respiratory infection caused by the RSV virus. It can spread to the lower respiratory tract and cause pneumonia or bronchiolitis. Bronchiolitis is an infection, or I'm sorry, an inflammation of the small airway passages that are entering into our lungs. Symptoms it causes, mild cold-like symptoms, but in older adults, it can cause fever, severe cough, wheezing, rapid breathing, difficulty breathing, or bluish color of the skin due to lack of oxygen. How it spreads, similar to the other respiratory illnesses, but when an infected person coughs or sneezes, you get the virus droplets from a cough or sneeze in your eyes, nose, or mouth, or when you have direct contact with the virus, like kissing a face of a child with RSV, or you touch a surface that has the virus on it, like your doorknob, and then you touch your face before washing your hands. Vaccination directions for RSV. So RSV is not currently an annual vaccine, meaning you don't need to get it every single year. So if you've already received an RSV vaccine, then you don't need another dose at this time. There are 3 different vaccine brands available for RSV. If you are 60 years old to 74 years old, for this age group, the RSV vaccine falls under what's called a risk-based recommendation. So if you have risk factors like lung disease, heart disease, diabetes, chronic kidney disease, or have a weakened immune system, you could be eligible and should talk to your doctor about it. If you are 75 years old and older, then everyone in this age group is eligible for the RSV vaccine. Okay, this is another one I spelled out so it's a little easier to pronounce. So pneumococcal pneumonia, what is it? It's a serious bacterial infection caused by Streptococcus pneumoniae or pneumococcus bacteria. Symptoms it causes. It depends on what part of the body is infected. So it can cause mild infections like ear infections and sinus infections, and your eardrum pain, fever, redness, sleepiness, facial pain, cough, headache, postnasal drip, sore throat. So not fun, but more mild infections, or very serious infections. So like pneumonia, which is a lung infection. Symptoms include chest pain, cough, fever, chills, rapid or difficulty breathing, low alertness, and confusion in older adults. Also, meningitis, which is a brain or spinal cord lining infection, causing confusion, fever, headache, sensitivity to light, and stiff neck. Or bacteremia, which is a bloodstream infection, which can cause chills, fever, and low alertness. How it spreads, again, similar to other respiratory illnesses, but pneumococcal pneumonia is spread through direct contact with respiratory secretions like saliva or mucus. It can be transmitted from person to person via coughing, sneezing, sharing objects, or kissing. Vaccine directions. So if you are 19 to 64 years old, should be vaccinated if you have certain medical conditions and other risk factors like chronic heart, liver, lung disease, diabetes, you smoke cigarettes, and anything else that might affect your immune system. And if you're 65 years old and older, then everyone in this age group is eligible. And just to keep in mind, there are 3 different types of pneumococcal vaccines available with different recommendations and requirements based on your own personal medical and vaccine history. Those are the names of the different ones: PCV 15, PCV 20, and PPSV 23. So it's best to talk with your doctor about which one is right for you. Okay. Now we're talking about Tdap, in particular pertussis, which is the P part of Tdap. Pertussis is also known as whooping cough. So what it is, it's caused by a type of bacteria called Bordetella pertussis. Symptoms it causes: really severe coughing, really hard, really fast, until all the air in the lungs has left, and you're taking a big inhale afterwards, making that whooping sound, which is where the name comes from. Sneezing, nasal discharge, fever, sore throat, watery eyes. With pertussis in particular, the coughing can be so severe that it causes bruised or cracked ribs, abdominal hernias, or broken blood vessels under the skin or in the eyes. Also, just a note, pertussis can make older adults very sick, and they can also spread it to babies and young children, which is why it's important to be vaccinated as older adults as well. How it spreads: when an infected person coughs or sneezes, the germ-filled droplets are sprayed into the air and can be breathed in by anybody nearby. So if you're 64 years old and younger, just the Tdap vaccine every 10 years is recommended. For those who are 65 years old and older, should receive, it's called the Boostrix Tdap vaccine if it's available. It's recommended for this age group in particular. But again, always ask your doctor about which one is right for you. Okay, this one I'm sure you've heard of as well: shingles, which is caused by the varicella zoster virus. So shingles is caused by the varicella zoster virus, the same virus that causes chickenpox. So after someone has had chickenpox, the virus remains dormant in their nerve tissues, and then later on in life, the virus reactivates and then leads to shingles. So symptoms it causes: a painful, itchy rash that develops on usually one side of the face or body and can take anywhere from 2 to 4 weeks to clear up. Unfortunately, long-term nerve pain is the most common complication of shingles. Other symptoms include fever, headache, chills, and upset stomach. And then how it spreads: a person can pass the varicella zoster virus to anyone who isn't immune to chickenpox. So while shingles itself isn't contagious, the virus that spreads to someone, the virus can spread to someone who hasn't had chickenpox or the vaccine, like children who are under the age of 12 to 15 months who may not be vaccinated, and they should avoid direct contact with any open sores of the shingles rash. So it's really important to be careful around infants and those who aren't immune yet if you have an active shingles rash. Vaccination directions. This is also not an annual vaccine, so you don't need one every year. Adults who are 50 years old and older can get 2 doses of the shingles vaccine. Usually, you wait about 2 to 6 months in between those doses. And something to keep in mind too is there's no maximum age for getting the shingles vaccine, which means you can't be too old to receive the shingles vaccine, which is important. If you are between the ages of 19 and 49, you should receive it if you have a weakened immune system or other chronic illnesses or diseases. And again, talk to your doctor if you have a question about that too, and which one's right for you. Okay, so where to get vaccinated? You can get vaccinated at many different locations around your community, including your provider's office, pharmacies like CVS or Walgreens, community healthcare clinics or public health departments, hospitals, community health fairs or events, and local chains or grocery stores like Jewel-Osco, which, by the way, Jewel-Osco offers 10% off your groceries if you get a flu vaccine at one of their locations. So it's important to find a location that's convenient for you to help you keep up with the recommended vaccines to stay protected. So don't hesitate to ask your healthcare provider when you get the or where you can get the vaccines that you need. And I just wanted to talk one slide about spotting vaccine misinformation. As we know, in today's world, misinformation about vaccines can spread quickly on social media and other platforms. We are bombarded with new information every day, so it's important to be cautious about what you read and what you share. So, here are a few tips to help you spot and avoid news that may be misleading. So, number one, check the source. So, reliable information usually comes from trustworthy health organizations or experts. So, look for information from sources like the CDC, which is the Centers for Disease Control and Prevention, the WHO, or WHO is the World Health Organization, the FDA, Food and Drug Administration, or your healthcare provider. Number two, beware of sensational claims. So claims or uses really dramatic language, it may be misleading. Facts are usually presented in a straightforward and balanced way. So just something to be aware of. Number three, look for evidence. So reliable information is supported by evidence, like research studies and official data. So be skeptical of posts that lack sources or evidence. And then number four, consult a professional. So ask a trusted professional when in doubt, ask your doctor or a healthcare provider for accurate information about vaccines. By staying informed and skeptical, we can make better decisions about our health and avoid the pitfalls of misinformation. Okay, so we've reached the end together. So as we wrap up, closing thoughts and takeaways from the day. Remember that vaccines are a key way to keep ourselves healthy, especially when we get older and our immune systems aren't as strong. It's important to stay up to date with your vaccines, especially with respiratory virus season coming up just around the corner. Check with your doctor about which vaccines you need, where you can get them. Vaccines are thoroughly tested to make sure they're safe and effective, and the benefits are definitely worth it. Make sure you're vaccinated and encourage your friends and family to do the same. This way, we can all stay healthier and prevent the spread of diseases. So, and with that, I'll wrap up and we can open up the floor for the Q&A session. Thanks again so much for being here today. If you have any questions about asking anything we talked about vaccines or anything we talked about today, feel free to ask.
Thank you so much, Sam. We have several questions. I wanted to open it before we start with those. Open it to the callers. Feel free to unmute your audio by dialing *6. No questions from callers? Star 6. All right. Well, definitely amazing presentation and information. So I know that at least I will have to go back and review all of those. A lot of information there. Excellent, excellent. So thank you for that. One of the first questions that I have is in terms, you mentioned several times that the vaccines are safe. They are tested. They have very high safety standards. Plus, they continue to be monitored for safety throughout the years. So one of the questions that we have in regards to, there are some people who believe that vaccines cause diseases. I don't know if they're referring necessarily to symptoms, but indeed there are some claims about diseases, if there's any truth to this.
That's a great question. And it's a question I've gotten before many times out in the community. So when you get a vaccine, I'll use the flu vaccine as an example. And I talked a little bit about how that vaccine works. So it's a part of it's like a dead piece of the flu virus. It's in the vaccine. We give it to your body. Your body recognizes that it doesn't belong there. It makes antibodies to fight it off. That way, when you get exposed to it in the future, you're protected. So it is not possible for you to be infected with the flu from a flu vaccine. And same thing with COVID too. COVID vaccine works a little bit different. We actually give your body the instructions on how to make a part of the COVID virus, and your body makes those things, but your fighters, the antibodies in your body, recognizes that it doesn't belong there and is going to fight it off if you're ever exposed in the future. But you cannot get COVID, the COVID infection from the COVID vaccine. So great question. It's something I get a lot, but yeah, in this situation, it's not possible to get an infection from the vaccine.
Thank you.
Mm-hmm.
I wanted to go back to that. I think this is one of under the whooping cough, the Boostrix vaccine.
Yes.
Boostrix.
Yes, I believe so. Yeah.
You said that people that are younger than 65 is every 10 years, but for those people that are 65 plus, is it also every 10 years or is it more frequently?
Oh, that's a good question. I don't think it's every 10 years for 65 and older. I believe it's I don't think you would need it every 10 years. I'll need to check that. I don't want to answer if I don't know the answer, but let me double check that. But definitely if you're 65 or older, talk with your healthcare provider about that. Mention that, should I get the Boostrix vaccine? And then how often do I need it? That's a good question. Thank you.
This was a note that I made to myself. I love the historic connection about how the process immunization, the immunization process was named with the connection with the cow.
The cow, yeah.
In Spanish. So,
yeah. Yes.
Let's see, I have other questions here. Any reason I should not get a vaccination?
The only reason you should not is if you have ever had a severe allergic reaction to the vaccine before. That's something that we ask about, and you should be always asked about before you get a vaccine, is if you've ever had an allergic reaction to any vaccine before. Allergic, meaning like anaphylactic, where you get, rashes and welts and you have trouble breathing and your throat closes up. Obviously, that would be an issue. Otherwise, sometimes, especially those who have weakened immune systems, so maybe those who had an organ transplant or going through chemotherapy, it may be a conversation with your doctor because your immune system isn't at 100%. So you don't want to give it something that may challenge it even more. So again, if you're in those situations where your immune system is not the strongest or really affected, then talk to your doctor about whether you should get the vaccines now or if they'd like you to wait a little bit or whatever your situation is.
Interesting, interesting. Thank you.
Mhm.
And can you say a little bit more about, there's a higher dose, the flu vaccine, higher dose for those that are 65 and older?
Yes. It's a different brand. I forget the name brand, but it's built with, how do I say this? It creates a stronger immune response in those of that age group. And there are different kinds. So I didn't want to take too much time on the different kinds that there are, but there are a few available. So separate from the typical flu vaccine that I would get, or maybe you would get every year, just once a year. But over the age of 65, that's definitely a conversation for your doctor because there are a couple available. So that may be a conversation about which one is best for you, which one you should get.
Excellent, excellent. There's some questions coming up, but before, related to this one, you said that fall is the best time. However, is it appropriate if you get to the winter and you realize, oh, I never got the, it's the best time, but still, is it appropriate to have it later, like during the winter months?
Yes, yes. Better late than never, we always say. Yes.
Okay.
So
Okay.
typically we want to do it right soon, September, October, right when respiratory viruses start to really pop back up in the winter months. But let's say you forget or something happens in your life or whatever, and it's December, it's January, getting it at any time, especially in these winter months, is better than not getting it at all. So get it as soon as you can. That's the recommendation. But even if you were to miss that prime September, October month, then just get it as soon as possible, as soon as you can.
Okay, great. All right. So why was the Johnson and Johnson, J&J vaccine taken off the market? If you had one of the first of those vaccines, J&J vaccines, which vaccine should you be asking for right now?
Oh, so with the Johnson and Johnson vaccine, and I don't know the data or numbers or specific information, but because of the tracking they were doing on side effects and what were happening with people and reporting and stuff like that, they were finding that there was a very rare instance of some people getting a blood clot. So I don't know how many, I don't know what years we're talking about. Again, I don't know the data, I don't have it in front of me, I'm sorry. But because we're able to track vaccines and side effects and what's happening, they determine this is a rare side effect. So we're gonna take it off and take a timeout from it. If you've had the Johnson and Johnson vaccine before, you can get any vaccine you'd like to. My community health team, we typically have Moderna with us. It doesn't matter if you've had any other COVID vaccine in the past, Johnson and Johnson, Moderna, Pfizer, any of those. As long as it's the appropriate time for you to get the COVID vaccine, which it will be soon in the next month or two,
Yeah.
then you are eligible for the COVID vaccine. Any brand of the COVID vaccine is fine.
Fantastic. And actually related to your team and doing these vaccinations across sites.
Yeah.
Do you do them in the community as well, meaning like in health fairs and all of that? And the reason I'm asking is because from these differences, do people actually have to show an ID, or do you, or do we trust that people say, yes, I'm 58 or 65 or?
That's a great question. Yeah. So really what we do when we're out in the community is we are able to access a website called iCare. And of course I can't remember what the whole acronym, it stands for something, but essentially it's an Illinois database for vaccines. So if you have ever received a vaccine in Illinois, you have an iCare account. So when I'm looking at my laptop or our team is looking at our laptop, all we need is your last name, your first name, and your birthday. I can click your profile and I can see your entire history of just your vaccines that you've gotten in the state of Illinois. So that's a way that we verify if it's the right time for you to get a vaccine. Um, that way we're not, because, we lose our vaccine cards or we forget when our last one was. It's very common. It's not a problem. So we have access to that, and other healthcare providers and doctors' offices can access that too. But really all we need is your name and birthday. And we can look you up in the system and we'll see right away if you're eligible for a vaccine.
Oh, fantastic. Yeah, there was something about the cards. It's like we were very good about it at the beginning, but
Yeah, it's not we still give them out if people want them. It sometimes is helpful depending on maybe where you work or where you want to go or visit. It might be helpful to have a physical card, but we can still make those if needed, but it's not really anymore.
yeah, yeah.
But that's another way, again, that system that we can access, we can view that, and other healthcare providers should be able to do that too.
All right, one more chance for colors. Otherwise, I have no more questions. Accolades through the chat and all of that. So thank you so much, Sam. Excellent presentation. We actually need to go back and take notice about all the ages and all the recommendations. Fantastic.
Yeah, absolutely. Thank you so much.
We greatly appreciate you. Thank you. All right, so let us tell you then about what other programs we have coming up. So Franco, whenever you can cue the upcoming presentations, that will be great. Oh, fantastic. So we're gonna start with the Falls Prevention Awareness Week, which is also coming up, is in September. And to celebrate, Rush Generations is going to be hosting informational webinars, trainings, and interactive group workshops to empower our community and prevent falls. For those watching at home, you can scan that QR code that you see there. We have tested it. It's safe to scan it. It's in the below left corner. With your phone, you can scan it and you will be directed to the flyer with all the falls prevention programs this September. But remember, you can always call us at 1-800-757-0202, not only to register, but also to find out more information about these programs. And the next two evidence-based workshops that I'm going to be speaking about now are also part of this set of programming that we have prepared for you. The first one is Bingo Size. Next slide. Bingo Size is a 10-week program that combines the game of bingo with fall prevention exercises. So we would like to invite you to play bingo, come and play bingo and meet new people, all while learning about techniques to reduce falls. Bingo Size is exercise for your mind, body, and spirit. And the upcoming workshop will be held in person at a senior center very close to our campus, Central West Senior Centers, or Senior Center, excuse me. It will be run on Tuesdays and Thursdays, beginning on September 12th and running through November 19th from 10 a.m. to 11 a.m. And you can call us again at 1-800-757-0202 to register. Then we are going to offer Tai Chi for arthritis and fall prevention. This workshop helps participants improve balance while fostering mindfulness. Other benefits include relief of pain and stiffness. It reduces stress and improvement of quality of life. It is offered in 16 one-hour sessions. It goes for 8 weeks. And the program has demonstrated a 40% reduction in falls. Each class is designed with a focus on proper alignment of each warm-up exercise and Tai Chi form, and can be adapted for seated positions. The upcoming workshop is going to be held virtually using Zoom, and it will be running on Wednesdays and Fridays beginning September 25th through November 15th, 1 hour from 11 to 12. Shalnas in Your Voices aims to empower older adults to discuss what matters most to them as they age. So please make sure that you record a video. We truly want to learn from you. Consider sharing your wisdom on why it is important for your healthcare team and your loved ones to know your goals and wishes and what matters most to you. You can, again, scan that QR code to record on a mobile device or a smartphone. Feel free to let us know if you had any difficulties, but it's a pretty neat way of recording what matters most to you and then sharing those with your loved ones and providers as well. Excuse me. We hope to see you on our next lecture, which is going to be Wednesday, September 4, is on falls prevention awareness. As always, it's going to be at 1 p.m. through our YouTube channel. Feel free to join us on that day, and then also check out all those other falls prevention awareness programs that we're going to be offering that next month. It's coming along. So a lot of things that we are providing, a lot of information and programming so that you're healthy, especially during these months that we just mentioned about. So feel free to join us in these programs, but always to call us if you have any questions. The number is 1-800-757-0202. We hope